You remember you called me only once.
Myself?
I don't know who called me. I came. Since that time, did we have any meeting?
No, as with yes, and I think we'll talk after.
It's just that I thought I was late. I didn't know that you're actually not ready. Good afternoon, countrymen and women, and good afternoon, members of the press. Welcome to today's update. Let me begin by tendering profuse apologies for the tardy commencement of our update today due to circumstances beyond our control, and we will endeavor going forward to ensure that we begin these updates on time so that we do not disrupt your planning. We profusely apologize for the disruption in your time schedules. I recognize the presence of the Honorable Minister in the Vice President's office. Honorable Oli Papiri, welcome. And let me recognize the presence of the Permanent Secretary and his team. Permanent Secretary of Technical Services is accompanied by the Head of Laboratory and Pathology Services in the country, Dr. Shvemba, and also the head of infectious diseases programs in the country, Professor Mlenga. I further recognize Honorable Martin Malama, who's got too many titles. His first title is that he's my former classmate, and the second title is that he's a former Inspector General of Police, and he's Member of Parliament for Kanchibia, and Chairman of the Caucus of MPs in Muchinga, and Parliamentary Chairman on the Committee on National and Foreign Affairs, National Security and Foreign Affairs. Would like to recognize in our midst the presence of Bishop Chidima, the Synod Bishop for the United Church of Zambia, and all the clergy, and welcome you all to this update. The President of the Republic of Zambia, His Excellency Dr. Edgar Chagolungu, has been coordinating a multi-sectoral, multidisciplinary government approach to COVID-19. COVID-19 is primarily a public health emergency. However, it has disruptive effects on the economy and many sectors therein. With COVID-19 being with us for a number of weeks now, we have been called to reset. We've been summoned to reset to a new normal, and this entails that activities that have been eased will take place, though subject to public health regulations, guidelines, and certification. And further, these activities that have been eased will be subject to review based on the evolution of the pandemic. Countrymen and women, the COVID-19 outbreak status in Zambia today, I shall report on the validation of tests that we did in Nakonde, and also, in fact, in TDRC, and also the few tests that we did in Lusaka. Let me emphasize that the laboratories in Lusaka in the last 72 hours have primarily focused on validating the tests earlier conducted at the TDRC for Nakonde, Copperbelt, Northwestern, and Central Province, and therefore have done fewer tests for Lusaka in the last 72 hours. Validation is part of quality control checks, which is routine, and in view of the high positivity that we found on those particular areas, those spikes in those particular areas, there was need to validate, the data coming from the TDRC laboratory. The few cases that were done in Lusaka were only 30, and those 30 cases all came out negative. The following validation of tests performed on the 9th and the 10th of May, and I wish to report an additional 174 new cases out of the 338 tests that have been performed and that were performed on the 9th and 10th of May. This therefore brings the cumulative number of cases to 441, including 7 deaths and 117 recoveries. The 174 cases that have been reported today include truck drivers. It includes travelers from across the border in Nakonde, individuals in health facilities, staff at ports of entry, individuals targeted through the mass screening and testing, and also the contacts of the known positives. If we break down by province and by area, in Muchinga province, Nakonde in particular recorded 126 new cases. The Copperbelt recorded 29 cases, and when you unzip that, 22 came from Mundola, while Chingola had 1, Mpongwe 1, Kitwe had 1, Masaiti had 4. In Northwestern Province, we had 5 new cases, and Solwezi had 4, and Kalumbila 1. Central Province recorded 14 new cases, 3 in Kapiri and 11 in Kabwe. Distinguished ladies and gentlemen, countrymen and women, we have no discharges reported in the last 24 hours, and all the patients that are in our various admission facilities are said to be in a stable condition. Globally, and before we get to the global picture, let me just talk about our people that we have discharged from the quarantine facilities, those who are at high risk and have been monitored either in the quarantine facilities or in certain designated homes. There are now 3,759 cases that we've discharged from the routine quarantine, and the alerts from the community that we appreciate have now reached 1,937. Globally, we have 4,256,090 cases with 287,336 deaths. 1,527,583 cases have recovered, and this is happening in 212 countries and 2 conveyances, and this is as at 8 a.m. this morning. Africa has recorded 3,026 new cases in the last 24 hours, bringing the number of cases to 67,778, including 2,355 deaths. 23,989 cases have recovered, and this is happening in 55 countries and territories. In Africa, the Center for Disease Control is structured to operate in 5 regions, and in the SADC region, Zambia hosts the hub, and so in SADC we report cases, 11,375 cases with 225 deaths and 4,605 recoveries. Members of the press, countrymen and women, it is important to note that there are countries that surround Zambia, particularly the 8 countries that surround Zambia, that influence the epidemic in Zambia. And it's important to note that from these 8 countries, there are 1,814 cases with 72 deaths and 427 recoveries. Congo leads with 1,024 cases, followed by Tanzania, which is reporting 509 cases. Now remember that we are saying the epidemic in Zambia will be influenced by what is going on across the borders. That's why we have to look carefully at cross-border collaboration, what is going on across the borders in our neighboring countries. Nakonde, we've already seen the high incidence of cases in Tanzania, and so we did get the first hint when we had those 2 cases from Chingola, and then we did see a spike in the number of cases in Nakonde as we reacted with mass screening and testing. We also see that the movement of people from Nakonde is associated with the cases that we're reporting on the Copper Belt and in Northwestern Province. So these are all important linkages that we need to focus on. Nakonde remains our main focus in our operations this week, and we are focusing on key areas. Number 1, we will continue to have that lockdown of Nakonde and no traffic in and out of Nakonde or across into Zambia or out of Nakonde into neighboring countries, only allowing those trucks carrying essential goods, and even those, there's a system that has been set up where the trucks will be escorted to deliver, and after offloading, the drivers are quarantined. Further, we are going to ensure that during this closure, we continue to disinfect the border, we disinfect public places, we're going to ensure that we have stay-home orders for people to avoid getting infected. We are going to ensure that we train and retrain port staff, be it immigration, ZRA, health, retrain and train them. And for those who are trained and are properly clad, then we'll redeploy them to the borders. It is only after we have disinfected the border, trained human capital, and ensured that the process is safe, that we shall now then reopen the border, because now trade will be done in a safe environment. The third thing that we're going to do is to continue mass screening and testing in Nakonde. And the idea is to remove everybody that is positive and manage them in a facility. It's also important to note that we will continue supporting interventions in our facilities that look at surveillance so that we are able to pick up any new cases. We must be concerned and therefore must work together when it comes to factors that fuel the epidemic. Today, one huge factor fueling the epidemic is movement of trucks. Movement of trucks is a grave danger. If we analyze the data that we've given you, 66 are truck drivers. 66 are truck drivers, and that's not a small number. Therefore, we must ensure, in line with President Lungu's address, ensure that there are stringent measures when it comes to management of border traffic and when it comes to management of trucks. And let us also ensure that the Public Health Act is adhered to, including the statutory provisions that have been promulgated. Furthermore, let us all be disciplined. Let us not go into Nakonde, and let us not get out of Nakonde. And let us not even use any other routes. While Nakonde is an infected area, take note that the people come from Nakonde, get into Isoka, get into Chisali, get into Muchinga. So Muchinga itself is a hot spot. Furthermore, there are places like Mbala and Pulungu that are potential hotspots. Stay home, and our teams that are surveillance teams in nature will come into those places and make sure that they do targeted testing and mass screening. But for now, we would encourage all our friends, citizens, relatives, brothers, and sisters to stay where they are. And even those of you who are outside Nakonde or outside Muchinga, don't go into Muchinga. Muchinga, by the Public Health Act, Nakonde in particular is defined as an infected area, and allow the public health teams to carry out interventions to ensure that the people of Nakonde are safe. We want to assure you that the measures that are being done include finding the cases, finding those cases, and when we find those cases, we are putting them in isolation facilities where we are treating them adequately. And once they are safe, they are well, we'll send them back into the community. Secondly, it's important that when we find those cases, we do contact tracing. So for the people of Nakonde, the people of Muchinga, continue cooperating with the public health teams. The reports we have thus far are that the people of Nakonde are very cooperative, in the response to COVID-19. Continue cooperating and ensure that you participate in the mass screening and targeted testing. That if you're picked out as a contact, please make sure that you are tested, screened and tested. Beyond that, we will ensure that case management is done properly at Chinsali General Hospital and in one or two facilities within Nakonde. Other quarantine facilities are being set up within Nakonde to ensure that we do not allow those who are positive to be in the community so that we can curtail community spread. Countrymen and women, we are now seeing a rapid increase in person-to-person transmission, And if you've taken note, we now have Lusaka, Kafue, Chingola, Chilawombwe, Ndola, Masaiti, Pongwe, Kitwe, Kapirimposhi, Luansha, Kabwe, Solwezi, Kalumbila, and Nakonde, having reported cases so far. Therefore, let us all be responsible and stay home. The Ministry of Health, working with its multilateral partners and other stakeholders in the country, have already deployed human resource to Nakonde. We've already deployed PPEs to Nakonde. We are reinforcing the response, and will ensure that we coordinate coherently with other stakeholders from DMMU, from Home Affairs, and from other trade-related ministries such as Commerce and Industry, ZRA, and so on and so forth, Ministry of Finance. So we are urging all stakeholders to continue working with government of His Excellency President Lungu as he attempts to defeat COVID-19. Together we can defeat COVID-19. I thank you.
Patience Marker from CTTV. Just a follow-up on the sensitization of the disposing of masks. And most people recycling the disposable masks, which is hazardous now and is a risk to the general public that are purchasing the recycled masks. Looking at a situation where we have looking at a situation where people are still using the disposable masks for more than a day, and there's still people that are recycling those masks and taking them and recycling them. Then the second question is, why can't a tangent be floated on the number of the tests that are being conducted daily, looking at a situation where we're having a lesser number recorded today and a higher number recorded the next day? And then why can we have the number of tests escalating every day? Then the last question is another concern, and why can't the media personnel be allowed to film in the isolation centers, provided they are given a protective gear and censor the identity of the patients, because most people are now saying the pandemic is not real, so they need proof of the people in the isolation centers, given reference to BBC film in the isolation centers. Thank you. Good afternoon.
Good afternoon.
My name is American Shawani, also from CDTV. My question is, with the continued rise in the number of cases being reported, there is concern on the levels of ignorance in adhering to the public health guidelines. What is being done to ensure that there is compliance with the members of the general public, especially with regards to public transport and markets? Thank you.
Good afternoon, Minister. Quick one. I want to find out, you did indicate that the people who are in quarantine facilities are in a stable condition. And the if at all we have a totally different strain of COVID-19 in Zambia, when you look at the recoveries and just the way the numbers that we've been recording. In addition, I want to find out what threshold is considered to be the peak for Zambia and what measures has government put in place to ensure that we attend to these cases at the peak condition. Lastly, Minister, is there a law put in place that maybe the public is not aware of with regards to the wearing of face masks in public? Because we've received reports of police officers, traffic police, charging individuals not wearing face masks even when they are alone in motor vehicles. Thank you.
Honorable Minister, that was a round of questions that
Countrymen and women, these are disposable gloves. You use them for disposable masks, sorry. These are disposable masks. You use them only for 6 to 8 hours and you dispose them. Countrymen and women, if you have a cloth mask, like the one Honorable Minister is putting on here, you can reuse it just simply by washing it. So you wash it, iron it, and you reuse it. And this is a message that we must work together as a media to communicate to the public. Anything short of that is putting whoever is recycling at risk. So let us therefore be encouraged to use face masks that are of cloth because we can easily reuse them. Now, the number of tests that we are doing depends on the area. And the contact tracing does guide us. So sometimes we do, random, and like, because we don't have clear leads, but we just have evidence that there could be a problem here, and we're able to do, mass screening and targeted testing. But for now, what we need you to know is that the number of tests that come and are done and become positive on an area is basically dependent on the guest load in that area. The number of tests will be done and the positivity will be dependent on that area. If we look at the issue of filming in isolation centers, did you see what Masauso from ZNBC did when you just mentioned that? He said, "Ukaende go work." So if the media would like to accompany us as we go into those facilities, you are very welcome. You're very welcome. We'll dress you nicely and ensure that you don't get infected. But if they quarantine you after you come out of there, please don't come back to me. Yeah. So we have a Zoom facility within Levy Manawasa. And the other day, we were talking to our colleagues in the facility at Levy through Zoom technology. So it is possible to actually film what's going on there through Zoom. There is a question on whether, yes, we should be allowed to go and film in there, apart from the hospital being an infectious place. So putting you at risk, it's also important to respect the privacy of the individuals that are there. Adherence to guidelines, it's a call for you and me to strengthen risk communication so that the public can adhere to the guidelines. That's a very significant point. So you'll be able to see that risk communication is being enhanced in local languages, in English, in various parts of the country, in order for us to improve adherence to the public health guidelines and regulations. And that is of very high impact because the more people know, the more behavior change will be able to happen. If we look at the people living in facilities being stable, no one is on event, being stable, and therefore some people think that is a hoax in line with that question, and so on and so forth, and more specific. I want you to tell you, I want you to know from today, Zambia, that COVID-19 is not a hoax. COVID-19 will see cases increasing, and there'll be a time when it will plateau, it will flatten, and then start coming down. So is COVID-19 a hoax? No. Are the people, you want to go and film the evidence that this thing is actually a hoax? I want to tell you that a lot of them that you find feeling well there may have been well throughout because the disease was mild. They may have had it moderate, they may have had it severe. And what happens to these is that they'll go into, they'll need ventilator support, and they may have some symptoms that we'll actually treat using symptomatic therapy. But I want you to know that all the patients that we have in our facilities today are stable, no one requires ventilator support, and none of them have symptoms. When is the peak for Zambia coming? Well, we project the next 2 to 3 months by projection. So it is important to state that the President's call for us to cautiously allow certain activities to take place subject to adherence to the Public Health Act is spot on, because we can assure you that we have not yet peaked in Africa. And even the number of deaths has not yet peaked in Africa. So let us continue to practice what we've been told: hand hygiene, hand washing, physical distancing, ensuring the environment is clean, and that way we're going to avoid COVID in our country. So the peak is not yet there, and we'll see more and more cases. With our enhanced capacity to test, you see more and more cases. If you look at laboratory testing that we've been using in the past, we've been using PCR based, or polymerase chain reaction based. We've been using that as a basis for testing, as a methodology for testing. We have different technologies that we've introduced now called Gene Expert. The Gene Expert that we've put on board now will even help us to test in all the provinces. In other words, our capacity to test is improving on a daily basis, and therefore you will see more cases. You see more cases. Our capacity to test has gone up. You see more cases. We're in the surge. When we peak, it will show, and then plateau, then start going down. And remember that what is fueling this epidemic today is the importation of cases through the Nakonde border, the truck drivers moving and taking the cases all over. That's why government under His Excellency President Lungu has come up with stringent measures to stop further spread. Well, wearing masks is mandatory. We must wear masks. We must wear masks. And let me tell you, law or no law, put on a mask. You'll be saving yourselves and saving the family. So put on a mask. And the response from most Zambians is good. As to whether this is being put in our legal documents is a matter that we shall be guided.
Thank you so much, Honorable, for those responses. So wearing a mask is mandatory, but management will like to help you. But we're getting the infection or infecting others. Do we have any other questions? Okay, will you just go forward, madam, over there? Is there a third person?
Good afternoon, Honorable Minister. Darius from Diamond TV. Honorable Minister, it has been 4 weeks now since President Edgar Lungu directed you to devise incentives for our frontline workers, and that hasn't been done. I'd like to find out why you have failed to implement the presidential directive. Is it that our government really does not have money to give our frontline health workers who are risking their lives? Another question also, Nakonde have reported over 200 cases. It is on record. And one of the factors that we have indicated is that the
towns such as Nakonde itself, talk about Kazumbula and Kasumbalesa. While they are there, nothing is done in order to stop the spread of the virus. When they are there, they are able to go to shops, they are able to go to mingle with people in different areas. So I don't know if it's what government is doing about that, if we could call it some form of maybe, I don't know, hypocrisy, that the seriousness only comes when the traps are in the country and not while they are that side. Okay. Thank you.
Thank you so much. So, Mr. Mwamo, I'd like to make some clarifications.
I thought Dr. Kavala would just make a follow-up on that. Minister, the clarity I'm seeking is it is mandatory to wear face masks, but from the aspect of whether the police are in order to charge those found wanting. If at all it's necessary for one to wear a mask when they are alone in the car. Or for instance, I think I've had an experience where I leave home, I'm with my wife, and getting to work and meet police officers who are asking me why are you not wearing the mask? But I'm with my wife. You know? Yeah. So I just want clarity. It actually happened to me today as a police. Then just how many, in total, how many tests have been done from the time we had COVID outbreak to date? Thank you so much.
Honourable Minister, those were the questions for this round, so I'm going to just give responses to that.
Well, thank you very much. Incentives for frontline health workers, again, administrative processes, and these are underway, and we'll leave the administrators to translate the policy directive into action. And I can only assure you that this is a firm position and that administrative procedures are taking place and are not for this level. So administrative processes are ongoing through the government systems to ensure that that comes through. And let me reiterate President Lungu and government's commitment to ensuring that health workers at the front line are well looked after. Well, should Nakonde lock down with other borders in the country? Like I've always said, that there is need for that balance between economic activity and avoiding a public health crisis. Therefore, we will be able to decide that this area must be restricted to reduce the number of cases while allowing flow of essentials. That is extremely important. So the decision to lock down is informed by data or by analysis of the outbreak. So if we need to close any border, we'll get back to you and announce as the President shall direct, but that shall be informed by data. If we look at if you look at the other question that you spoke about the number of tests done, $10,600 tests have been done to date. 10,600 tests have been done to date, and we're still going up, still increasing the testing capacity and still going up. If we look at the reason why Brian Mwale ran into a police officer, who asked you for a mask? And he himself didn't have a mask. Brian, was that your question?
Yes, the police in order to charge those that are not found wearing masks. Somebody complained about that.
Well, like I've always said, why you should put on a mask is because you must create a barrier from the next person so that you don't get infected. So you don't need a policeman to enforce that. But if it is mandatory, yes, law enforcement officers will actually remind you to put them on. I just said remind.
Remind him because also the police officer wants protection from him.
Yes, exactly.
Thank you, Honorable, for those responses.
Well, the
So, flying into Muscat protects you and your family. Do you have any further clarification? Any questions? Your question on truckers? Okay.
What was your question?
I was asking about the truck drivers in Makonde and like when they are there, waiting to come into the country, nothing is done. They are able to go in different places and visit people, shops, and yet you only become serious about it when they are transported, when they are escorted in and quarantined.
Well, the rule is that when they come in, they're mandatorily quarantined. So going out of the quarantine facilities before they're released is illegal and punishable by law. So they should stop doing it because they will be in confrontation with the law. We will not allow truck drivers or indeed foreign nationals to come into the country and defy the quarantine laws. So getting into quarantine is important. So thanks for that heads up. Our teams on the ground need to ensure that quarantine is enforced.
Thank you, Honorable. That was the last series of questions. Unless there are any questions for the panel, okay, let's have you. You can come to us. Is there another one? It's around the person. It's the last round of personal questions. Okay, so we only have one.
Good afternoon. I'm Chimon from last evening. I would just like to ask if we had any patients who remain asymptomatic from infection to recovery, and if so, given the fact that asymptomatic patients have not been given any sort of treatment, would it be safe to assume that we've had patients in the community that have caught the virus and recovered without this detection? And secondly, in regards to the patients that have recovered, what's been the quickest or slowest period of recovery? And we'd just like to know the average time it takes for recovery.
The disease may be mild, in which case you just get maybe a fever, a flu, a running nose, and some headache, possibly some body pains, and the incubation period is 2 to 14 days. And so, there are a lot of people who get the infection, and within 2 to 14 days, they get the symptoms, and with time, they recover. Is it true that we don't give people any medicine in the facilities? No, it is not true. We treat symptomatically, meaning that if there's a high fever, we'll drop the fever. Maybe we'll use paracetamol, maybe intravenous paracetamol, or straight into the vein. That is one thing. The cases that we're managing there are being managed based on evidence that we have today. Some clinical trials are taking place, but the evidence that we have today is what is resulting in good outcomes.
The average period of recovery?
The period of what?
Quarantine, quickest period for recovery.
Or the shortest period for recovery that we have seen. We've seen 5 days. We've seen 5 days. And remember that some people that come into there are in the recovery phase before they come into there. So the period of recovery will even be much shorter.
And the longest?
38 days. So far we've seen 38 days. Yes, those two in Masaiti stayed for 38 days.
Okay, so 5 days to 38 days. Well, Minister, that was the last series of questions that we had this afternoon. We still continue having, well-wishers coming through to check our partners. It's here through United Church of Zambia, represented by Reverend Bishops in Suriname. We also have the
Also
Library and
receiving
Professional
something
Association of
like
technician who died whilst on duty. Further, we just want to commend you, Honorable Minister, your entire ministry, of course the frontline staff and the government at large, for the spirited fight that you put up against the fight against COVID-19. And we want to commend you most sincerely for keeping the nation informed regarding the developments of the pandemic. As you may be aware, for us that's of utmost importance to us as librarians, as information professionals. Our core duty is to provide information which is reliable, timely, and accurate, so we appreciate that, sir. However, we have also observed with dismay that the spreading of fake news on COVID-19 has continued. We therefore wish to once again join the Honorable Minister and the government in condemning this act, and we encourage members of the public to desist from this vice. We believe that fake information, sir, is just as deadly as the COVID-19. Honorable Minister, Lias today wants to compliment the efforts that government has put in so far, and we realize that this fight is not for the government alone. It's not the usual Boma Yanganepo. In this regard, our members and the President have sent me today to deliver the message to you and the nation that even if most of our libraries, most of our information centers are closed, we remain committed to our core duty, and we are engaging everybody to make use of online platforms in accessing information. For example, we have our Toma Library, which has composed a song just to spread the message on risk management on COVID-19. We have also our provincial librarians in Mongo, Lusaka, and Solwezi. They are repackaging information on COVID-19 by translating it into local languages. And this is being done both online and physically, of course, while observing health guidelines such as social distancing. Let me take this rare opportunity, Honorable Minister, just to invite you to like our page called the Ask Think Tank. You find this information that I've talked about. You can get the information there. In addition, we just want to encourage our parents, we want to encourage guardians out there to take this opportunity whilst children are home to create home libraries, and this can be physical and or of course electronic. We have information on our page. You can access some of the free books that are online. You can download for the purposes of ensuring that your children are learning whilst at home. Honorable Minister, we also want to make an earnest appeal to all our internet service providers
Honorable Minister of Health, Mr. Chibuke, MP, to you all senior government officials present, leaders of civil society organizations present here, to the well-wishers, members of the press, distinguished ladies and gentlemen. I'm Sydney's Chima, the Bishop, Senior Bishop of the United Church of Zambia. I've been accompanied by the Director for Community Development for the United Church of Zambia and the Director for Communications Department for the United Church of Zambia and other representatives that are here. Sir, our Honorable Minister, I wish to hasten to stand here on behalf of the United Church of Zambia to inform your able office that we have mobilized an assortment of personal protective equipment and other items that would wish to be given to the mission schools of the United Church of Zambia and rural health centers as we partner with government and other well-wishers in the fight against COVID-19. The food stuff will be given to young mothers in Kanyama, chronically ill people in Kafiwe, and Tandiana home based care for the aged people out there in Western Province in Mwani. All these have been on the focus for the United Church of Zambia. Honorable Minister, sir, the items which have been mobilized by the structures of the UCZ and our cooperating partners, namely Cosna Mission from Germany and World Renew from the United Kingdom, include meal, containers of cooking oil, salt, bags of soya pieces, bags of beans, herbs, 90 kgs groundnuts, printing of COVID-19 posters, hand washing baskets, and assorted personal protective equipment outlined in our list, which our directors have mentioned here will be able to avail to you, Honorable Minister, sir, immediately when I retire and rest my statement. All this, Honorable Minister and distinguished leaders of our society, is worth 318,277.12. I wish to mention, Honorable Minister, sir, that as I speak, we are in the progress of making cotton masks worth 15,000, which will be distributed among the needy in our society. As the United Church of Zambia, we are, like others have put it, elated by the efforts of the multi-sectoral team and government that is working tirelessly in combating the deadly COVID-19. We would also like to thank organizations and individuals who have continued offering support towards this noble cause. Honorable Minister, sir, as I digress here and just wind up, because Greg may not be with us. You may wish to know that the United Church of Zambia has been collaborating with the government in offering social service
government and other well-wishers during this training moment. We again pledge that we will continue doing our part in soliciting for more support and sensitizing community members within our jurisdiction to live safely within the guidelines given by the health sector of our government, and all these our high profile and experts in the health department in this field, that we may together fight this fight together. Finally, we would like to wish all those who are sick of COVID-19 and the other ailments, we wish them God's mercies and a speedy recovery. Honorable Minister, on behalf of the United Church of Zambia, we wish to convey our deepest thanks for availing this special opportunity for us to come and be part of these gallant men and women of God in the country, to join fingers together to fight this pandemic. May God continue to bless you and to bless our republic. Thank you so much for your time.
So much, Gisho. The Church of Zambia for that generous donation. And now to people from the day. She's promised me that she's a very good songwriter. So. She's a very good songwriter.
The Honorable Minister of Health, Member of Parliament of Nigeria, Honorable Ministers present, senior government officials, ladies and gentlemen. I stand here on behalf of the Country Director, Action Aid Zambia, to express our solidarity in this very difficult period. Action Aid stands with the Zambian people and government during this difficult period that has caused deaths, as well as posing serious economic challenges. We commend the efforts of government that they are making to fight the COVID-19 pandemic, and we urge the public to adhere to the guidelines to mitigate against the COVID-19 pandemic. As a contribution towards the COVID-19 crisis mitigation, Action Aid today is donating protective items which include hygiene kits, masks, hand sanitizers, hand wash baskets to be distributed to our target population, women and youth, amounting to 49,000 kwacha, 48 in weight. The items will be distributed to Chipata, Makonde, Sesheke, and Lusaka through the provincial and district health offices to allow us to operate within the laid down guidelines. In the next 2 weeks, we plan to donate very similar items to women marketeers in selected districts. Just to mention, Honorable Minister, that we are implementing other interventions towards COVID-19 mitigation
response plan, as Action 8 Zambia, is pegged at a total of 6.9 million kwacha for the next 6 months. In conclusion, we thank you, Honorable Minister, and all the frontline staff. And as Action 8, we recognize the efforts of the frontline staff and especially the nurses who are commemorating their day. And we wish you success in your efforts aimed at combating the COVID-19 pandemic. Thank you very much.
Thank you. That was Action 8. May I now call upon Moyo. And as Moyo is coming, may I have Red Cross ready. And Red Cross will be followed up by Boys Brigade of Zambia. So Moyo.
Honorable Minister of Health, Dr. Chitamchukia, eminent secretaries present, senior government officials, members of the press, all protocols observed. My names are Benhunga Kalinda, the General Manager of Umoyo Natural Health. We are from Umoyo Natural Health Limited, a Zambian company established in 2007 and running 10 retail shops, 9 in Lusaka and 1 on the Copper Belt. We sell herbal products and various supplements and nutritional products. Honorable Minister, we have come here to support the good cause that our government and ministry are doing towards control of COVID-19 pandemic. We've come to donate alkaline water to encourage our health personnel and patients to drink water. Water keeps one hydrated, helps with biochemical processes in the body, cleanses and detoxifies, and alkalizes the body to enhance fitness, energy, and also improve the immune system. Honorable Minister, as we are going into the cold season, we want to encourage each and every one to keep hydrated by drinking enough water. We thank you for the opportunity given to be a part of this noble cause and appreciate what you are doing. Thank you. We are donating 1,000 bottles of 500 mils and 10 liters by 100 containers valued at 13,000.
seeing that the numbers are not increasing as much as they would have increased had it not been for your efforts. As you know, Honorable, Zambia Red Cross is an auxiliary department or organization that works to support the efforts of government, whether it's in an epidemic or in a disaster situation. And for that reason, I think as Red Cross, usually we are the first to respond when there is an epidemic or when there is a disaster. And in this instance, I think under COVID, I think that we've been working with the Ministry of Health as well as Zambia Information Service to disseminate information and also to do community sensitization for our people in different communities, and to be specific in 14 districts which were initially identified as priority districts. As you may be aware, Honorable Minister, last Friday, the 8th of May, was the World Red Cross and Red Crescent Day, and we were commemorating this day in different parts of the country. And we felt that as part of the commemoration, we should make a contribution towards the fight of the COVID-19. And in summary, I just want to make sure that I mention the things that we are donating. We are going to contribute by donating 98 safety goggles, 100 sets of protective wear, 457 pairs of sterile gloves, 186 bottles of liquid soap, and 20 hand washing facilities. Our sincere hope is that though this might be a small contribution, but it will enhance the fight against COVID. Honorable Minister, we hope this contribution will further strengthen the fight even as the nation society continues rendering its auxiliary role through various preventive and control measures mounted in the priority districts. I thank you, and I want to ask that the Lord continue blessing our nation and your guidance as we fight the COVID-19. Thank you very much.
Lastly, I call upon Mr. Maso Sifula, National President of the Boys Brigade of Zambia.
Honorable Minister, senior government officials present, and shall simply say all protocols observed. My colleagues and I from the Boys Brigade of Zambia are here to join the many companies and organizations and individuals that have come here to thank you, to encourage you for the work that you and your team have done and continue to do to stem the spread of this very, very serious disease. I have with me my two vice presidents, Ms. Lucy Kasanga and Ms. Isaac, and then I also have my treasurer and our publicity secretary. Mr. Minister, you may not be aware that the Boys Brigade of Zambia is a Christian youth organization with approximately 25,000 boys scattered all over the country. We also have more than 4,000 officers who are total volunteers who work with our boys in the various areas that we have a presence. So we felt, Mr. Minister, that we would also like to be identified with the good work that's going on. And to that effect, we have some small gifts that we'd like to pass on to you. But before we do that, let me once again remind you that we, as a Christian organization, we believe very strongly in prayer. And we do believe that going forward, you can be rest assured that we will do our very best to continue to pray for you, to pray for the nation and the world at large, so that our good Lord up there can intervene. Mr. Minister, as I said, we have more than 25,000 boys. We are virtually represented in just about every district. What we have done through our officers is to train the boys, to sensitize the boys, so that wherever they go, especially in the remote areas of our country, this message can be delivered to their families as well as to the community. We believe that each one of us, at whatever level we are, we have a role to play, support you for the tremendous work, the noble work, the sacrificial work that you and your team have done. Please accept these our little gifts. We have masks, 20 boxes, totaling 500 masks. We also have sanitizers, and these are 360, which we would like to pass on to you. In addition, Mr. Minister, I want to mention that we've taken the trouble to train our boys to make face masks with our symbol. These masks will be circulated, given out to the various communities where we belong. With that, Minister, I thank you and pray that you continue to do the good work your team are doing. Thank you.
Those were the last donors to the COVID fight, COVID-19 fight. And I'll call upon the Chairman for Minister to wrap up
Let me begin by acknowledging with unfettered gratitude the generosity from the United Church of Zambia, hereby represented by the Synod Bishop Schilima. When the Church holds hands with government in the face of adversity, we see God's favor and we see the solidarity that we need, and victory is nigh. We thank you very much for that partnership with government in the provision of health services, education services, and now even in public health security. We are grateful. Let me thank Action Aid for being action-oriented. Thank you so much for the support. Your donation is of high public health impact, and it will go a long way in saving lives and pushing the COVID response. So appreciate you most sincerely. I'd like to thank Umoyo. Umoyo would like to preserve lives, and you've worked tirelessly in order to promote wellness. Your actions resonate with government's agenda to enhance wellness, prevent diseases, to place premium on preventive interventions, to promote nutrition. Would like to thank Umoyo for the partnership with government and for coming on board to support water, sanitation, and nutrition as government aspires for universal health coverage. and also as government battles COVID-19. Let me thank the Red Cross Society of Zambia, who've been all-weather allies in the fight against disease, and they're always on hand to support us whenever we need to hold hands to defeat any calamity. They're always with us. The librarians have come on board, and the librarians are key in health system strengthening. You are our pillars of strength in information management, and when you partner with us to support the COVID-19 response, we feel enhanced. We want to invite you to work with us even in other pillars of our health systems. We are touched by your donation. We'd like to thank the Boys Brigade of Zambia, and it's very good to see senior citizen Maxwell Sichula back in the spotlight, who has served the nation diligently in various positions. We thank you most sincerely, and we thank you for what you're doing in modeling our boys to become good citizens, and for the work that you're doing in coming up with masks. You are saving lives. So we thank the Boys Brigade of Zambia, for that. I continue to thank everybody that has come on board to donate and to support the cause for COVID-19. Let me reiterate the call by His Excellency President Edgar Chagwa to all the provincial teams to ensure that we heighten preventive interventions and ensure we strengthen surveillance. The surveillance in our provinces, in our borders, should be enhanced. The call for us to strengthen surveillance comes in the wake of the importation of cases from the Nakonde border, and initially from the port of entry at the airport, and later on from the port of entry in the southern part of Zambia. So strict border controls are key in stopping importation of COVID-19 cases. So we urge the provincial teams under the provincial ministers to heighten surveillance, to heighten border controls, and ensure that importation of COVID-19 is restricted, is limited. I urge the people of Nakonde, Muchinga in general, to support the multi-sectoral teams that are implementing high-impact public health interventions: disinfection, screening, testing, quarantining those people who are ill and treating them, and support them by ensuring that you stop moving, stop leaving Nakonde, either across the border or outside Nakonde. It is but just for a defined period of time, so that we can make Nakonde a safer place for trading for all. So let us all support Operation Nakonde. I would like to re-emphasize that the validation of results that we were doing in the last 2 days is normal, and it is accepted globally. And if you see a spike or an outlier, it is important for you to ensure that results are validated. So the validation of results is normal laboratory practice, and this is a global practice. So we'd like to thank our technical team that is charged with the responsibility of running that cluster of laboratory diagnosis, led by Dr. Shivemba and your team, Dr. Msonda and Dr. Monze, and our colleagues from the vet school, Dr. Semulundo and team. We'd like to continue thanking the media for supporting the cause through risk communication and through communication to the public, and I urge you to continue working with us to fight innuendos and wrong data through social media. The nurses that are frontliners are celebrating the International Nurses Day. We thank you and hail you as the heroes and heroines of the quest for universal health coverage. In the words of His Excellency President Lungu, well done. You are the true warriors who have managed to fight maternal mortality, bring down HIV/AIDS, reduce malaria morbidity and mortality, and sacrifice to work in remote parts of the country, saving children from vaccine-preventable illnesses through immunizations. enhancing safe delivery. So the nurses and midwives, our heroes of today, and this is your day. We salute you. We wrap up with the figures: 441 cumulative cases, 174 cases out of the results that we didn't get on the 9th and the 10th, 174 new cases. That brings to 441 cases cumulatively. 117 discharges, 7 deaths, and in the last 24 hours, no discharges. Let's continue working together and support the COVID-19 response. We'll meet tomorrow.